Understanding respiratory issues in Brittany dogs. Are Brittany dogs prone to respiratory issues? When it comes to choosing a furry companion, there are many factors to consider. One important aspect is the breed's health and potential susceptibility to certain medical conditions. In this article, we will explore whether Brittany dogs are prone to respiratory issues. The Brittany, also known as the Brittany Spaniel, is a medium-sized breed known for its superb hunting skills and friendly nature. Originally from France, this breed has gained popularity for its energy, intelligence, and versatility. But does their genetic makeup put them at risk for respiratory problems? To answer this question, we need to examine the breed's physical characteristics. Brittany's have a well-balanced and muscular build, with a deep chest and a narrow waist. These physical attributes make them agile and capable of enduring long hunting sessions. However, their chest depth can also make them prone to certain respiratory issues. One respiratory condition that some Brittany dogs may develop is called brachycephalic airway syndrome. This syndrome is most commonly seen in breeds with short muzzles and flat faces, such as bulldogs and pugs. While Brittany's do not have extremely short muzzles, they do have a relatively short and wide head shape, which could potentially contribute to respiratory problems. Symptoms of brachycephalic airway syndrome may include excessive snorting, difficulty breathing, frequent panting, and loud snoring. These signs can indicate that the dog is having trouble getting enough oxygen into its lungs. It is essential to seek veterinary care if you notice any of these symptoms in your Brittany. Another respiratory issue that can affect Brittany's is exercise-induced collapse, EIC. EIC is a hereditary condition that occurs when a dog's muscles become unable to function properly during periods of intense exercise. This condition can lead to heavy panting, weakness, and even collapse. While EIC primarily affects the muscles, the increased respiratory effort during exercise can put additional strain on the dog's airways. To minimize the risk of respiratory issues in Brittany dogs, it is crucial to keep them at a healthy weight. Obesity can exacerbate existing breathing problems and put unnecessary stress on the airways. Regular exercise is also beneficial, but it should be done in moderation and with caution, especially in warmer weather. Overheating can further compromise a Brittany's ability to breathe properly. If you are considering adding a Brittany to your family, it is essential to choose a reputable breeder. Responsible breeders perform health screenings on their breeding dogs, including assessments for potential respiratory conditions. By selecting a breeder who prioritizes the health and well-being of their dogs, you can reduce the likelihood of acquiring a puppy with respiratory issues. In conclusion, while Brittany dogs are not generally considered a brachycephalic breed, their physical attributes can potentially make them more prone to respiratory issues. Owners should be aware of conditions such as brachycephalic airway syndrome and exercise-induced collapse, and seek veterinary care if any symptoms arise. Proper weight management and controlled exercise are key factors in minimizing the risk of respiratory problems in Brittany dogs. By choosing a responsible breeder, you can also reduce the chances of acquiring a puppy with existing respiratory issues.